So first of all, congratulations from Team Unipath for accomplishing such a wonderful job in Kolkata. So it's a really proud moment for all of us. And this is just a small token of appreciation from Team Unipath.
Thank you. Thanks a lot. And it's my pleasure to have it. And I'm really feeling proud that everybody is getting benefited. So especially the poor people are getting benefited from this kind of endeavor.
Of transplant you recently.
Oh yeah, this is basically haplotransplant because when I started searching for the matching of the patient, this patient is basically a thalassemia patient. It's a transfusion dependent thalassemia patient, and the case was actually failed when I started a different kind of drug which actually helps to raise the hemoglobin level. And that kind of treatment was actually failed. Then I started to find out any matching is there or not to do the transplant. So then I found that the patient is having an elder brother, 9 years old, but the matching is only half. It's a very challenging. That patient is not a very rich patient, so the poor patient. So it's not possible to do to spend a lot of money for the transplant. Then I thought that if the transplant is at all required, so why not the haplotransplant? It's very challenging, and this is also an advanced transplant in the world. And especially in the case of 3 years, just 10 years, 2 years, 10 months old baby. So I got the challenge and finally did it.
Basic general complications and challenges you are facing during these kinds of haplotransplant.
As because the matching is half, the main problem is the reactions that we call it the graft versus host disease. This is a very problematic point we usually face, and to combat different types of drugs are used. And not only that, the main problem is the patient is baby, only 2 years, 10 months. It's a very big challenge. So these two are very important, the challenge we actually faced.
Any specific challenges you faced in this particular patient? Any phase of the treatment or related to this particular patient you have faced?
Like any other transplant, especially in haplo cases, there are so many reactions, especially in the initial period. That means the cytokine release syndrome, CRS syndrome, just after giving the stem cell infusion. It happens very rigorously. To combat it, a different kind of drugs are used, and I have used this. This is the main initial problem, and later on different types of challenging problems like the hemorrhagic cystitis and different kind of engraftment syndrome, acute GVHD. These are the very dangerous problems you can face, and I have also faced it.
And sir, what is your views regarding during these kinds of transplantation? Lot of diagnostic tests need to be done. So, what is the criticality of lab diagnosis in these kinds of transplantation?
Yes, lab is the very important part of any transplant because there are so many high-level tests required for any transplant, like chimerism, whether this is successful or not. So not only that, CMV, different types of the BK virus, and the cultures, blood cultures, different types of high-end lab support is very much required.
If a laboratory having umbrella of testing in the same umbrella, so can it help you or you can send different tests to different laboratory. So how you perceive these kinds of things?
Obviously, under one umbrella is always helpful because many a times that have support, financially support or support is there for the patient party.
And clinical correlation?
Exactly. And the clinical correlation means, yes, obviously, if you have a little bit rapport, then you can share the problems with the pathologist, and that's very much helpful. Because when you are facing different types of report and you are sending your query to the pathologist or biochemist, and then he is giving the feedback, so it's a very good practice. It helps a lot, both sides, clinician and pathologist also, and biochemist also.
What next, sir? What is your next target?
Because transplant is a platform where you can treat different types of disease. So let's see what kind of any new kind of disease I can treat. Let's see.